Joining us now on the program is Jim Lydiard. He is the Chief Strategy Officer at HarmonyCares, formerly known as U.S. Medical Management. Joining us now on the Megacast. Jim, thanks for being with us today.
Yeah, thanks for having me, Tyler. Excited to be here.
Appreciate having you on. So first off, tell us about HarmonyCares and what your business provides to people here in our local area and across Michigan.
Yeah, great. Thank you. So HarmonyCares is not a new company. As you mentioned, it's a rebranded version of an already great healthcare company. U.S. Medical Management started providing homebound care to Michigan residents back in 1993. So what this rebrand really offers us up now is an opportunity to sort of harmonize, if you will, our various healthcare programs and business units into one. We provide house calls from a primary care perspective. We provide home health visits from nursing and therapy. We provide mobile lab, mobile radiology, and even hospice and palliative medicine when a patient needs that point. So think of us as a no cost or lower cost, simpler version of healthcare in your home.
So why the focus on home healthcare? Was that a market that wasn't being really covered in the healthcare industry, or is that somewhere that your business believed that they had the expertise and the personnel to really thrive and support a lot of people in need?
Yeah, great question. So as you probably know, or most historians know, providing healthcare in the home was not a new concept, but we sort of went away for it for the last half century. The reality is we're better to provide care. Fact is, our providers will tell you they learn more from seeing patients in the home than if the patients were to come into a clinic. We get to see a patient's routine. We get to see how they're eating. We get to see if they're taking their medications. So while it's a little bit more nuanced for us to get providers and get clinicians to and from the home, we feel like it's our responsibility to do so, especially to access those patients that, frankly, Tyler, may not be able to have the fortunate nature of accessing care like you and I do. So a lot of our patients are homebound, lack some of the resources, and really wish to avoid the half day or full day exercise of getting to and from healthcare.
And this provides them that sort of access and a variety of different forms of care as well. How has the COVID-19 pandemic affected those operations and the execution of these services, especially for those that are homebound, given that there was so much embedded separation of people, especially in the healthcare industry, over the course of the last couple of years?
Yeah, well, not surprisingly, right? It was very challenging for us, especially in the beginning parts of 2020 and even towards the end of 2020. We already serve a very vulnerable population, a lot of compromising health issues. So first and foremost, we had to make sure that our clinicians had the right PPE or medical equipment, if you will, to enter the home safely and provide care for these patients, because the last thing we wanted to do is subject them to anything we might bring in. The other thing that's come out of the pandemic, I think, is a more commonplace use of technology. So there was a time where we were providing mostly virtual visits, which means we would connect with our patients not face-to-face, rather through a device, a telephone, an email. And so we really had to make do for many months during the pandemic. The fact that now there are vaccines, better equipment out there, we've really found that our patients are relieved to allow us back into the home, and we've been able to enhance our care back again to, I'd say, a dominant face-to-face type modality of care. But the pandemic taught us a ton in how to reach those patients without that.
We're joined by Jim Lydiard. He is from HarmonyCares, joining us on today's edition of the Megacast. More information can be found on their website, HarmonyCares.com. HarmonyCares.com for more information. And so important in treating any patient in any form of healthcare is that bedside manner, that empathy for whatever ailment they may be going through as you're trying to figure out what's going on with this particular patient at this particular time and the ways that whatever's going on is affecting them, but also to provide that care. In terms of what you do, given that you're going into these people's homes, it is usually homebound individuals that cannot or really should not be making that venture outside of the home, as you said, for that long, arduous process often of going to the doctor's office across town in some cases. How much is empathy woven into the mission of your company and the way that your personnel works with their patients all across Michigan and in several cities across the U.S.?
I would tell you that this is probably the most enjoyable part of my work day to day, is to see the care and compassion that our clinicians have Um, Not a lot of, I would tell you that a lot of people get into providing care in the home, but not a lot of people stay without that conviction for treating patients like we do. And if you look up empathy, right, it's the ability to recognize, understand, and share thoughts and feelings with another person. I think our patients really embody the fact that while maybe our patients might have a very different life experience than we do, we just really try to remember the human side of delivering and receiving care. The fact is, Tyler, no one wants to end up homebound, right? But if and when they do, we want to ensure that the care team entering that home is respectful, sympathetic, empathetic, and that trust that we end up building because of that empathy is really what allows us to, I think, be that first call. When a patient is having an emergency, they call us because they trust us, and we've demonstrated, that empathetic way of providing care. Without that, they're just calling 911, and they're back into the unfortunate vicious cycle of how these patients that live in the home unfortunately receive more care in an acute setting or in a hospital than they often do in an outpatient setting, or as we do, provided in the home.
More information, again, can be found HarmonyCares.com. That is HarmonyCares.com for more information on this organization that has been conducting this business since 1993 with over 100 locations in 11 states in the U.S., including right here in Michigan. HarmonyCares.com. Typically, how do people get in contact with your organization and start that process of receiving that in-home care? If they've been going to a doctor for a long time, and certainly if they have some insurance implications and hurdles to get over in order to get that care. In some cases, it's really critical that they can start to get that care today. So how does your company help them bridge some of those gaps, particularly with the often pesky insurance companies?
Yeah, great question. So there's really several routes patients come into our service. First and foremost, you can talk to your current provider. You can talk to your current health insurance. If you're living in a senior housing community, you can talk to the staff there. You can also go online to the website you've referenced several times, Tyler, HarmonyCares.com, and you can find us and reach us and contact us through that. In any event, we do take most major insurances. We can be a provider that comes in and sort of by referral sees a patient or a resident of one of those senior housing settings. We do also have local offices. So you can also reach out to our offices in Ann Arbor, Flint, Grand Rapids, Kalamazoo, Lansing, Marysville, Saginaw, and our headquarter office in Troy. So we're very easy to get a hold of. We have a dedicated outreach team that's in the community trying to find the patients at the same time as they're trying to find us, because often it's just an awareness opportunity. The biggest complaint we tend to hear from our first patients, the first visit, is, I wish I would have known about you sooner. So that's why we're also trying to do shows like yours here, Tyler, to get into the Michigan community and make sure they know that there are resources just like us out there, and we're ready to serve.
So we've really mostly focused on that primary care element of this in-home care that you're providing with Harmony Cares. But what are some of the other forms of healthcare that are also being provided in the home by your company and its providers?
Yeah, it's a great question. So of those 8 or so markets I just mentioned, most of them we also offer Harmony Cares Home Health, which is a short-term, typically a nurse or a therapist coming into your home for some sort of rehabilitation. We also offer Harmony Cares Hospice. So if you or your loved one are at that point in your life where you need more of a comfort-based, what's called palliative measure of care, we provide services in those same 8 markets. I mentioned, I think, in the very beginning of the Megacast that we also offer in-home lab services, in-home radiology services. And these are all programs where we're happy to bring in as much as possible when the patient needs it.
Michigan locations include in Flint, Grand Rapids, as well as Lansing, Troy, Ann Arbor, Kalamazoo, so many different locations here. Saginaw also in the state of Michigan. More information can be found on harmonycares.com/locations to find them in your local area. We're joined by Harmony Cares, Jim Lydiard, the Chief Strategy Officer, on today's edition of the Megacast. You can find more information on their website, harmonycares.com. That's harmonycares.com. Jim, another couple minutes with you today before we'll say goodbye. Anything else that our audience should know at this time about Harmony Cares or the services that you provide?
Yeah, glad you asked. So, while we've talked mainly today about our mission to care for patients such as this, I think it's also worth noting that we provide care for a lot of our employees. And by that, I mean we're hiring. So, it takes a special type of clinician to come in and work with us, or non-clinician as well. But know that we have open positions throughout the region for clinical, operational, sales-driven positions. So for the listeners throughout Michigan, please head to our website and take a peek at the various roles we have available. We really try to make sure that our models are team-based. So rather than a clinician that's used to, kind of being on an island, doing everything for themselves, we think of our clinicians as sort of doctors or leaders of teams rather than captains of ships. And we really hope that we're creating a model that allows us to restore the joy of providing healthcare in this type of space. So as much as we're excited to grow in form of more patients to serve, we're also excited to grow in terms of a team. So please check us out there too.
HarmonyCares.org for more information. That's HarmonyCares.org to find more info. Jim, thank you so much for joining.
.com.
Sorry, .com. My apologies. Got that right the whole time. That's fine.
Thanks so much, Tyler. Appreciate it.